Well, June is Men's Health Awareness Month, and with the pandemic restrictions lifting, guys, this is a good time to get going and get done with that annual physical. Get it out of the way. Joining me is Dr. William Critchlow with Urology of St. Louis. Good morning, doctor.
Good morning, John. How are you?
Fantastic. How do I look?
Great.
Thanks.
This is a telehealth visit we're doing right now.
I know. How many of those are you doing lately?
We're getting more people into the clinic, but we're still open for telehealth, and it's a good option for folks who are worried about coming into the clinic or maybe far away. We can get most of what we need by talking to someone and reviewing outside records. It's a good option for a lot of people.
And I know that too, going and talking to my doctor, it's a lot of talk lately, and it's amazing what they can pull out of you. So what are some things that men should be aware of during Men's Health Month?
I think the most important thing by far is to be a man and go to the doctor.
There you go.
Good general recommendations: be active, get good sleep. If you're still smoking for some reason, you've got to stop it. That's the most important thing you can do for your health. But mainly be a man, go to the doctor, get seen, get screened. Men starting at around 40 years old should get established with a primary care provider. Screening for high blood pressure, cholesterol, thyroid disease, depression. Those are easy things that save lives.
And since you're a urologist, I'm going to bring this up. It's amazing the number of guys I say, have you had a recent PSA test? And they're like, what's that? And I'm like, you're in your 50s and you don't know what it is? I mean, that's important.
It's very important. Prostate cancer is the most common solid organ malignancy cancer in men. It's the #2 cause of cancer deaths in men. The PSA is a simple blood test, and that combined with a prostate exam can help identify men at risk and men who might need further testing. Yeah. The American Urologic Association recommends that we should consider screening guys for prostate cancer generally between the ages of 55 and 70, starting at 40 for higher risk folks, folks with a family history or African Americans who are at higher risk for prostate cancer. And we know from very large studies that screening men does save lives from prostate cancer. And it's an easy thing to do for a cancer that affects about 1 in 7 men.
Yeah, men are professional procrastinators, I find, when it comes to health, and the women in their lives are often the ones who say, get going, you don't look good, you got to get to the doctor. And I think for that reason, the CDC reports that American men die 5 years earlier than women, and from all kinds of things, heart disease, cancer, unintentional injuries, you name it.
That's very true. Men die about 5 years earlier. 2015 was the first time that we've been recording that the life expectancy for a man in America declined. And I think a big reason for that is guys don't go get their screening that has been shown clearly to help save lives. Being male is bad for your health. So we need to be especially cognizant of our routine maintenance and our preventative care. We're the opposite of that. Men are about 25% less likely to see a doctor over the past year than women.
All right.
There was a study a few years ago, 81% of guys can name their first car, and 54% of guys can remember the last time they saw a doctor.
That's amazing. Dr. Critchlow, thanks so much. He knows what he's talking about. He was at the Mayo Clinic at one time. He's the pride of Cape Girardeau. We appreciate that. And we have more information. That's right. We have more information and a link to Urology of St. Louis on fox2now.com. I don't think